Hello, this is Robert McMullen, MD. I'm a psychiatrist in New York City, and I specialize in psychopharmacology and also TMS, transcranial magnetic stimulation. I went to Georgetown Medical School and Columbia for psychiatry. And I want to talk about postpartum depression, depression that occurs right after pregnancy and often during pregnancy too. I want to say two things in advance is that women should prepare for their pregnancy in a number of ways, but the two most important ways is they should be taking folic acid to help prevent neural tube defects, spina bifida, where the spinal cord is open down in the back, and babies being born without a brain. And the other thing they should be doing is taking vitamin D, which is a steroid hormone that we make when we're in the sun. And a few thousand years ago, we were out in the sun all the time. So we made huge amounts, and now we make practically nothing. And both of these are very important for the baby and the mother. It's important for the baby's health and the mother's health. And I think you should look into both of these. You should also ask your physician to do a test related to folic acid. It's called an MTHFR test. Sounds like a bad word, MTHFR. And that is a test that has to do with folate metabolism. And about 1 out of 5 women and men are going to be homozygous for a certain gene. You don't have to remember all this, C677T, that when you have a double dose of this gene, you cannot make use of the folic acid. And then you should be taking the real folate vitamin in order to protect your baby. And it also is important, especially in that case, to be taking this to help prevent depression. That's the MTHFR test. And the vitamin D dose should be about 5,000 to 10,000 units a day, usually at least 5,000 units for anybody weighing around 125 pounds. Now, postpartum depression. Is really regular depression, but it's very complicated because of the causes and the treatment. And there's also postpartum highs. So someone who is very bipolar, like a bipolar 1 manic depressive, or somebody who's had some big highs as well as depressions, they have 8 times the chance they're going to have a high after their pregnancy than at other times in their life. And they're going to have a fairly high chance of having a manic episode. Now, even among men, there's a very high incidence of mania postpartum. Now, why do men have this? Well, they studied them, and it turns out that these men who got manic were probably because of their doing what modern fathers do, and they went down during the childbirth and held hands with the mother through the night. So they were wide awake all night. And if you deprive yourself of sleep, that's a good way to send yourself into a mania if you are bipolar 1. The men had a bipolar episode just about as frequently as bipolar women do post-pregnancy. So that indicates that maybe the manias that women have postpartum are primarily because of sleep deprivation rather than the hormonal changes. Now, but to change to depression, this seems to be largely because of the hormonal changes, that the estrogen and progesterone and other hormones, including steroids, go up to gigantic levels during the pregnancy, and then in 72 hours drop from 7 times normal down to normal, what they were before the pregnancy. This is a huge drop, and this seems to be a major cause of the postpartum depressions. Now, they're also caused by other reasons too, that if there's a lack of social support, that the husband is not around, or he's not very helpful, or there's a bad relationship in the marriage, or there's a lot of financial challenges that people aren't together on or can't do anything about, or the mother just doesn't want this child for one reason or another, then that really raises the risk of a postpartum depression. And one doctor suggested that there may be an evolutionary reason why postpartum depression is common, or why we have that proclivity, is that if a woman is in the situation where she has no good support, look at over the past 2.5 million years of humans being up, walking around on their hind feet, and being a member of a group always, a band of hunters, anywhere from 10 to 40 or 50 perhaps. And if the mother didn't have a support, that her husband died or he was unavailable, going into a depression might be a good way of getting people's attention and demonstrating that she really needed people to chip in and help out, that she had to engage other people in helping her out, or she wasn't going to be able to do it herself. So that may be another reason this is easy to go into. Now, another complication is, what history does the mother already have? If the mother is depressed during the pregnancy, that's the highest risk she's going to go into a severe depression right after the pregnancy, if she's already depressed and you can't get her out of it. If she's had a history of recurrent depressions over the years and isn't in a depression right now, she's still at much higher risk. And if she's had previous postpartum depressions. Now, some people have had 5 or 6 pregnancies, and now they are also in a normal mood. They've been in a normal mood all their life, and at the 7th pregnancy, they suddenly have a severe postpartum depression. Everyone says, well, maybe she didn't want this child, but no. In this case, too, she was looking forward to the child. She had the resources to take care of the child. Often these postpartums happen just by, I don't know, I guess you shouldn't say chance, but they're unpredictable. So if somebody has 7 children, they might have 3 big postpartum depressions, and one cannot predict after which pregnancy they are going to occur. Now, if a woman has a first-degree relative, that means a brother or sister or parent that has any psychiatric illness, it can be depression, but it could also just be a bad anxiety disorder, any significant psychiatric problem, she's got a 50% higher chance that she'll get a postpartum depression. And if she has a first-degree relative that is manic depressive, that has bipolar 1 disorder, even though he's very stable now for years, but if he wasn't on medication, he might have a manic episode and then a depression. Then she has 3 times the risk of the average person of getting a postpartum. And these postpartums are common. They occur in maybe 10 to 20% of people. And then an even larger proportion of people get at least a period of baby blues where they're sad and weepy for 2 or 3 weeks or so and have a few symptoms of depression that goes away. And I want to mention one severe form of postpartum depression is called postpartum psychosis. This happens in about 1 out of 1,000 mothers, and they become quite psychotic and can be dangerous, suicidal or homicidal. And one of the famous cases that was reported on where a woman in a postpartum psychosis killed her children that woman was bipolar 1. She had been valedictorian of her class, and she had had a mood disorder over the years. I don't know all the details, but partly because of being very religious, somehow she and her family had fallen off, keeping her on the right medication and believing that she really needed to take the medication. And so she became quite psychotic after the pregnancy and ended up killing the children. And that's a terrible outcome. And anybody that has a postpartum psychosis should immediately be put in the hospital. And they generally recover well. Now, so there are these predictors of postpartum depression, and any patient I have that's had a depression before, even though they're doing very well, I warn them that there's at least a 50% chance they're going to have one, and that we should really work at trying to prevent it. The things I like to do, if possible, to prevent it is have the person on a very small dose of lithium, just 150 milligrams, and Lamictal during the pregnancy. If possible, if they're really stable, then I'll try to have them on nothing at all. The problem when a woman has a child with a birth defect is they are going to frequently feel very guilty and say, gosh, if I hadn't taken that one Valium pill I took, well, I took it 3 or 4 times during the pregnancy. They look for some reason that could have caused this, but 1 or 2% of babies have a birth defect. So if one can have somebody on no medication at all, or on such a low dose that they're not worried that they're doing any damage, that makes it better for them in the long run. On the other hand, you don't want the person to be very depressed, because you're exposing the baby to worse things than medication. If the person is severely depressed during the pregnancy, then she's releasing all these steroid hormones and adrenaline, and she's releasing all sorts of chemicals that are having more effect on the baby than most therapeutic medications. Also, being depressed in a postpartum depression is not good for the baby. There's studies on this that it causes developmental problems in the baby in the long run. And I'll never forget in medical school and psychiatric residency how often it was spoken of the condition called failure to thrive. Somebody would bring a baby in, even to the emergency room, or just in to see the pediatrician, and there's nothing wrong with the baby, but the baby's not thriving. The baby is not growing. The baby's not eating well. And in these cases, the mother is depressed. The fact that she's very depressed and she's not doing the normal things of snuggling the baby and touching the baby and kissing the baby and things like that, the baby has this syndrome, whatever, where they withdraw and they don't thrive. And if you bring the mother out of this, the baby will get better, or you may have to have you'll have to have some substitute mother in the meantime. Now, if I can get away with people who are mildly bipolar or atypical depressions and bipolar 1, if I can get away with just using Lamictal as the main medicine during the pregnancy, I feel fairly good. There's strong evidence that Lamictal does not cause birth defects, or very little, and the neurologists love it. If somebody has a seizure disorder for pregnancy, they really try to switch them to this, because most of the anti-seizure medicines have a high risk of birth defects. And towards the end of the pregnancy, when the estrogen levels are really high, that causes the breakdown of the lamictal to accelerate. So towards the end of the pregnancy, you have to go up to at least double the lamictal level you had in the beginning, and then as soon as childbirth occurs, you go back to the previous dose. Another thing that can be taken during the pregnancy and after is omega-3 fish oil. There's two things that some people say are contributing to the high rate of postpartum depressions. Are vitamin D and omega-3s. On an evolutionary basis, we are very deprived of these. With the fish oil, these omega-3s are what we make 40% of the walls of our brain cells if we can get enough of the fish oil. And now we eat all of these omega-6s. Just let's call omega-6s corn oils, because that is an omega-6. Corn oil is in everything. When you have bread, they put corn oil in it to keep the bread moist so it won't dry out and be a hard crust in a couple of days. And it's put in all sorts of foods. And so this overwhelms any omega-3s we have. We get some omega-3s from meat we eat. We get it especially from fish. Fish is full of it. And if we still ate brains, like if we ate a cow brain or any other type of brain, then it's full of the same omega-3s that our brain uses, so you're getting gigantic amounts of it. But brains aren't popular, I guess, because of the fat content, but also that prion, the Creutzfeldt-Jakob disease that George Balanchine died of. That has been spread among deer and cows at times. In any case, those two things are really low, and if you supplement those during the pregnancy and after, they may help. And there's some evidence of this. The vitamin D, just to make this a little stark, we've only been farming for 12,000 years. And for 2.5 million years, we've been hunter-gatherers. And even when we were hunter-gatherers in Europe, how much clothes did we wear? In the summer, you could wear fur, or you could weave something from plants, or you could wear leather. And none of those sound too comfortable. So we probably wore close to nothing. And we evolved, when we left Africa 60,000 years or so ago, into Europe, we evolved a whiter skin in order to make adequate vitamin D, because we've been making it for millions of years. We don't have fur covering us. The sun could hit our skin and we make it. And so if you have very little clothes on, you can make 10,000 units a day. And now we make 0. Because you have to be out there in a bathing suit for an hour in the summer, in the middle of the day. Anyway, these things are low, and that may be another reason. But if you are at risk of the postpartum depression, if you have a heavy family history of it, or a bipolar disorder, or you have had a lot of depression yourself, you should really be followed by a psychiatrist during the pregnancy, and especially right after. If you don't want to expose the baby to much medication, you can really take all you want right after. And you really can take most anything in the last 6 months. The baby's fully formed by the end of the first 3 months. And then you can take medicines that would cause birth defects because it's too late. The baby's formed. Anyway, it's an important subject.
What about TMS?
Oh, TMS. Well, TMS is actually an ideal treatment during the pregnancy or after, because it's not exposing the baby to anything. The only risk is of causing a seizure, epileptic seizure, what happens in 1 out of 10,000 treatments. And we actually have had none. At first I thought I had one, but it was actually a fainting episode. It's a long story behind that, but you're not exposing the baby to anything, and the mother just has to come in, and usually you're thinking about 30 treatments. With all the explosion of research in TMS now, it's pretty well proven that if you do 2 treatments a day, you'll get better twice as fast. So if the person did twice a day for 15 days, you don't have to do them consecutively, that would have a huge impact. And sometimes doing it 5 times a day, if it's a real emergency, if you do it 5 times a day for 2 or 3 days, you can have a dramatic effect. And we've done that a couple of times. And so that's worthwhile. And likewise after childbirth. After childbirth, the mother can take almost any medication, only very tiny amounts of it end up in the breast milk. The exception is if she's on a high dose of lithium. Then the baby's level of lithium could be half as high as the mother's. That's about the only exception I know of. And of course, the mother should keep taking the vitamin D while she's all her life, but especially during breastfeeding. Right now, the first 6 months of a baby's life, they can absorb calcium and make bone okay without adequate vitamin D. But after the baby's 6 months, then he or she needs the vitamin D, or they can't absorb the calcium from their mother's milk. In countries that, such as Saudi Arabia and Arabic countries and Qatar, where some women are very religious, and if they breastfeed for a year or more and they never go out in the sun and they're not taking any vitamin D, you're actually having kids grow up with rickets, with their legs bowed. And this is also happening because these countries are so hot, it's unbearable. And in the ones where the population is very affluent, like in Qatar, people don't even, they don't leave the apartment, they don't leave the house, they don't leave the air conditioning. So of course they're not getting any sunlight. And so the vitamin D levels are very low. And it's been a huge problem in London and in Boston. In the past, as much as 80% of the population had rickets because of all the smog from the coal that was burned for heating, 100 years ago. It was a gigantic problem. It's somewhat solved because they put a very small amount of vitamin D in milk. I think they put 100 micrograms. Although a 10-pound baby really should have 400 micrograms per day. And often the 100 micrograms they say they put in the milk isn't all there. It's only 50 or none at all. In any case, this is Robert McMullen, and I just talked about postpartum depression, and to be sure it's taken care of, and to be sure you take folic acid or L-methylfolate and vitamin D during the pregnancy, and it would also be a good idea to take fish oil. And by the way, there's no mercury in fish oil. The mercury is in fish, meat. So a predator fish from the oceans like salmon and tuna might have a lot of mercury. Thank you very much.
Thank you very much, Doctor.